So we're going to start off today about the shoulder pain. We're really excited to have all of you guys here. Hopefully you guys have written down some questions, or maybe you'll come up with some questions as we're going over all of this. And if you guys have any friends or family that you want to share this information with, please help them learn more. We're trying to help people prevent injuries and know what to do to recover quickly, right?
By the way, I'm Dr. John Elmer. I'm the handsome one here. And this other guy is Dr. Brad Clementson. We're glad to have you with us.
We have one bring the looks and the other one bring the brains. So we got some of both here.
We'll let him think that.
So John and I have been working out here in West Jordan for a while now, and we love it here. We've got a great team, great staff. So it's been a lot of fun. Should we get into it? All right. Maybe it won't let me. There we go. So there's a bunch of injuries. Has anybody here just shout out or shoot a message? Have you guys been on our Facebook page? Have you seen those Facebook Live videos? I know Megan's seen some. We've seen you on there. But some of those Facebook Live videos that we're doing every single week, we're teaching about a lot of these injuries. And we want to get into some of these injuries with your guys' specific questions. So you can see the whole list up on the screen right now. If there's any ones that you have specific questions about, write them in the comments. We'll make sure to get to them again towards the end, or if there's anything that comes up throughout the thing, please let us know. Anything else?
And this list, it's not all inclusive. This is probably the most common list of injuries that we see relating to the shoulder. But if you have any other shoulder pains or concerns or worries, or you've heard or been told something different, shoot that in the comments and we'll try and touch base on it.
Awesome. So when we look at injuries, there's a very common cycle. So let's look at the cycle that we've got up here on the screen for you. You've got these aches and pains. They're kind of stopping you from doing what you want to do. I had a patient last week he literally said this to me. He said, I took 2 weeks off, or no, 2 months off. He took 2 months off from going to the gym. He's a gym nut, super fit guy. And he's like, I took 2 months off because just this burning pain in his arm. And so he was avoiding activities that he loved. The pain got in the way, so he had to stop. So that's that next one, you stop the activity. So then he was taking some pain meds, some rest, and he went back to the activity. And he's trying like, okay, maybe it's been long enough. I took 2 months, and he's back in the gym. The pain came right back. And then finally, years later, in his case, it only took 5 months. So he was one of the smarter ones. But for some of us, it takes us 5, 10 years. I had a lady just a couple weeks ago, it took her 25 years to finally go and get help. And we're getting surgeries, we're getting steroid shots, or seeing a physical therapist. So ultimately, our goal is to stop this cycle. We want to stop it earlier. The sooner we stop it, the easier it is to fix the problem. One of my favorite analogies with this is that if you compare your body to your house, and if you've got a leak in your basement, the repair is a lot easier. You've had way less damage if you repair it right after you notice the leak after a couple days. But if you let it leak and soak into the wood and then, during the summer it's okay, but the winter it starts leaking again. And we go through that cycle for a couple of years. Now we've got black mold, and now even our family's getting sick. So let's stop the cycle early.
Today we're talking about the shoulder, but this cycle doesn't apply only to the shoulder. I had a patient several years ago that I was actually working with him for his knee, and got his knee feeling better. He was a little bit older gentleman, and he said to me, he actually broke down in tears and said, John, I'm doing things that I haven't done in 10 years. I'm doing things with my grandkids that I've wanted to do for a long time. And so the point is, no matter what it is that's bothering you, no matter what the ache or pain is, don't let it get to the point that it's altering your lifestyle. Don't let it get to the point that you're stopping doing, or you can't do what you want to do. Brad and I are good. We're awesome. But there are those situations that maybe we can't help. But by and large, we can do a lot to help you get back to or do the things that you love to do or that you really want to do. So keep that in mind.
Yeah, and I could go on with more stories. I keep having stuff come to mind, but maybe if we have time at the end, we'll tell more stories about that. So there's a couple things we really want to give you guys, and this is not one of those webinars where we're just like, okay, how do we sell you something? This is literally, John and I are like, okay, we want to give you guys information. We want to prevent injuries. So the 2 gifts that we have for you guys at the end are completely free. There's no obligation. It's not like you're signing up or some sales pitch. This is literally free stuff, information to help you stay active and fit. So stick around for the end. We're going to have all that stuff for you.
So the things that we want to talk about today, we want to hopefully encourage and motivate you to make some changes. Are there changes that you can make? And oftentimes the changes or the modifications are easy. Things that we can do, we can help you learn what movements need to change in order to help minimize pain or discomfort. We can help you understand how the muscles and the bones and the joints all work together. Are you tight in one area and we need to work on stretching things out, and do we need to strengthen another area? The strengthening and the stretching, that combination and having things work together appropriately are really key to any joint, but especially to the shoulder joint. And then what are some exercises that you can learn to get back to moving freely?
And with that, ultimately, I like the saying, we can lead you to water. You can lead a horse to water, but you can't make the horse drink, right? And so ultimately it comes down to you. Are you willing to make that change? Are you willing to do the hard part? Because the only way that we improve on something is we've got to do stuff that we're uncomfortable with. We've got to change habits, and you got to stick to it, and it takes a lot of work. And so I had a lady that I'm working with today that I was like, okay, here's what you need to do. And she comes back and it's like, oh, it's not better. Okay, but did you do X, Y, and Z? Well, no. I keep having poor posture at work, and I'm moving stuff like this all day. So I'm hunched over, and now I'm really tight in the shoulders and neck. Well, that's never going to change until you're ready to change. So make sure you're coming to the game ready. All right. So things that you need to consider when you're dealing with injuries, when you're dealing with movement problems, is that it's ideal that we fix the movement before an injury occurs, right? We want to, that's way cheaper, way less pain, and then you're not avoiding activities, missing out on 10 years with your grandkids, right? Yep. So fix it then. That's always going to be your best answer. This is so important with any injury, but especially with the shoulder. Today we're going to be talking about some of the joints in the upper shoulder that maybe we don't think about, and how that movement probably stopped working 5 years ago or 10 years ago. And that's what's leading to the injury that's happening today, because it's like, well, I used to be able to do this. Well, yeah, but you used to have better stability higher up in your shoulder. So that's obviously number one thing. And then if you already have an injury, like we talked about already, fix it early. Change now. You want to do something earlier on before all that damage happens.
Common phrase, common saying, an ounce of prevention is better than a pound of cure, right? And really that's what we're talking about and want to kind of address in a lump sum. You know, if we can prevent, if we can cut things off early on, then it's going to be better for your cure in the long run. So, you know, if you have shoulder injuries that are left untreated, it can lead to more stress and strain on other parts of the body. You can be overstressing and straining your neck, which can lead to headaches. You can be causing excessive movement at your elbow, which can cause problems there. So, you know, it can lead to tennis elbow or golfer's elbow. Those are common elbow pains that we hear about. So if we're not moving and using the shoulder appropriately, then we're overcompensating somewhere else, and that's going to lead to these other problems potentially.
You see that all the time with stuff like that, and neuropathy is a common one. Have any of you dealt with that? Do you guys wake up with numbness in your hands? Or maybe you're like, I have carpal tunnel syndrome, and you want to find out what's actually causing the problem. Neuropathy, that symptoms in your nerves down your arm, is a super common thing that's going to come from that shoulder rounding forward, crushing those nerves. And you can go and get your carpal tunnel surgery, and that's fine and expensive, and not going to do anything if the nerve's being compressed in your shoulder. So, and like John said, tension headaches is a super common one. That's one of my favorite pictures, because that's what it feels like.
Because that's what you're going to look like one day?
It's what it basically looked like already.
Okay. Injury management. So there are kind of 4 things that you can do, that we can do. And we've broken it down into these 4 categories. Extra passive, if you have an injury, you can do absolutely nothing. You can just let it be, hope that it goes away. and hope that it doesn't alter or affect your life. But doing nothing usually doesn't provide the best outcome. The next kind of passive action that you can or cannot take is doing surgery or medicine or steroids, and all of those options have certain possible complicating factors and things that need to be considered. And sometimes surgery is necessary. We're not saying that surgery is not appropriate. There are often times that surgery is necessary and the appropriate step to take. But if we can avoid that, hopefully that's better for you in the long run. If you take an active role, then what are you doing exercise-wise? What are you doing stretching? What are you doing with mobility?
And even nutrition.
Nutrition, yep, nutrition, sleep, general health, all those things fall into that category of being active, trying to take care of the problem. Extra active would be, what am I doing to prevent it? And Brad and I can certainly give some direction on how to prevent injuries with the shoulder, or again, other areas of the body. So if you're in that extra active role, maybe you feel a little tweak or strain and you don't want it to get worse, the sooner you address it, the better off you're going to be in the long run.
Yeah, those things are all very important, and honestly, extra active is my favorite one. But most of us end up finding ourselves in the active category, because that's why you're here, right? If you're here and that you've already got something going on, you're probably in the active category. If you're here and you're like, I don't have shoulder problems, but I want to learn more about my shoulder, then you're just extra active. So way to be. So there's a bunch of things that we're going to go over here. Like I said, if you have questions, we're here for you guys. That's what we're going to, that's the whole reason we're doing this, is just to help you guys. So we're going to go over the anatomy of the shoulder so you understand what we're talking about. Daily movements, things you're doing right now that you might be having problems with. And I want to hear from you guys. This is one that we use the shoulder for everything, right? We're getting dressed, you're picking stuff up, pushing the lawnmower, whatever it is, picking up your kids, stuff like that. We're going to talk about other joints, and then we're going to get into some of the pain management tips, and then what's next? What are you guys supposed to do next now that you've learned all of this stuff?
So just touching on the anatomy here. We're missing some of our arrows.
Yeah, they come on solo. Sorry. I was being creative. Sorry.
Yeah. So we're going to talk about four joints in the shoulder. So you have your glenohumeral joint, and that's what we most commonly think of as the shoulder. It's the ball and the socket. So you've got the ball part of your upper arm of your humerus, and it fits into the socket of your shoulder blade of the scapula. Then we've got the acromioclavicular joint, and that's where the clavicle, that's the bone that you poke along the front of your body and your shoulder, that joins up with the shoulder blade. That's called the acromion process. Then the next one, you have the sternoclavicular joint. That's where the clavicle joins up with the sternum and kind of helps everything to hang on the body. And then one joint that's not often considered is the scapulothoracic joint. So the shoulder is absolutely amazing. When you really look at the anatomy and you break it down, it really is just hanging on the side of your rib cage. And without all of these bones and muscles and joints working together, that your arm wouldn't be where it is very well, and it wouldn't function very well. And so really the shoulder is a pretty amazing part of the body.
Yeah, it's incredible that the whole shoulder is just go right over this AC joint. The whole shoulder is really hinging on that AC joint right there. It's kind of amazing that it works like that. But then that last one, the scapulothoracic, let's really dive into that and how that affects. Like I told you guys, we're going to talk about that upper shoulder. That's what we're talking about. How that is going to affect your injuries. If you have that coming on already, and then you're lifting and doing stuff that used to be okay, and now we're getting sore and achy, or now we tear a rotator cuff, it's probably because you didn't do something 5 years earlier to fix this problem that you already had. So let's talk about how that shoulder blade, that scapulothoracic joint, has support. So you can see a lot of these muscles here, the levator scapulae, the rhomboid minor, rhomboid major, and then you have this huge trapezius muscle that goes right on top of all of those muscles. All of these muscles, even including the latissimus dorsi, all of those control the shoulder blade and how it moves and corrects itself, stabilizing the shoulder so that you can lift and move stuff. I mean, we move heavy stuff with our shoulder, and without a shoulder blade, you just couldn't do that stuff. And even cooler, you'll see this later on, you won't have that same range of motion that you need. So in this, do you want me to do this part?
So this image shows all the different directions that your shoulder blades can move. So they can move up and down. So we've got up there, we've got down here. They can pinch together. They can actually come apart, wrap around your body. As you raise your arms overhead, they have to do a combination of moving out and up a little bit, and then they move down and back. And so really it's that scapulothoracic joint and the shoulder blade. It needs to be stable and solid against your body to then be able to have the ball and the socket part work appropriately.
So let's get into the ball and the socket part. As you can see, that shoulder blade is on the body, on your rib cage. Then we get a little bit farther away, and that's what everybody thinks of, right? That's my shoulder right there. And that's the ball and socket. Your humerus goes right into your shoulder blade. So, and that's called your glenoid fossa. And the mechanics of how that work are so important. And even if your shoulder is totally fine, your arm is moving how it should, but that socket, the socket part of the ball and socket is not stable, or it's drooping, or it's slipped, then you're going to get all of that pinching and that repetitive movements that are causing rotator cuff tears. You're going to get reduced range of motion or cause other stuff like frozen shoulder. So there's a lot of other stuff to consider. You've got the muscles around that joint, the rotator cuff, like I mentioned. There's the 4 muscles, the supraspinatus, infraspinatus, teres minor, subscapularis. I know it's a lot of medical words. Basically, it's those 4 muscles that just grab onto the head. And then you've got the bursa and other ligaments. You can see those ligaments right around. You see the acromion up top. Then where the collarbone attaches to that acromion, there's all of those ligaments that are holding that all together. If you have a shoulder separation, like we talked about in our video last week, that's where these ligaments are ripped, and that collarbone is no longer attached to it, and all of your shoulder stability is coming from your shoulder blade. You don't have that connection up top, and that's actually what I have in my right shoulder. And you lose that structural stability, so you have to build functional stability. So yeah, go ahead.
This is an image that just talks about that ball and socket. So here's the ball part, and then this is the socket portion of the joint. And so you have to have some rolling of that ball, but then there's also some sliding and gliding that needs to happen. If all it did was roll, then that ball would roll right up and out of the joint. And so it's pretty complex movement that has to happen there. When we talk about rotator cuff, the 4 primary muscles that are involved in the rotator cuff, they really have to work together in pretty good concert, pretty good harmony, in order to have that rolling and that gliding and that sliding happening all at the same time. That's what makes the shoulder for me just so miraculous. You've got the shoulder blade that's hanging on the side of the body, and then everything that's happening right here at this joint with the ball and socket part.
Yeah, it's really cool. So pull up the next picture. It circled some stuff over here. On the right side, you can see that you've got that extra space in the capsule. I forgot about that. And that just creates space for when it rolls so that you can actually roll. Otherwise, you're pinching stuff and the arm's just going to fall apart. But like we talked about on a couple slides back, you've got the combination of the shoulder joint, the ball and socket, with the shoulder blade. And do you see how all those muscles are pulling, and they've got to be like a symphony, right? Mm-hmm. Where they're pulling at the right times, and if you're going too early, we're going to be off beat and tearing muscles or much weaker than we should be, or pinching. Has anybody lifted their arm and you can just feel it pinch as you're lifting? And so you just avoid lifting the arm, right? Back to that problem of just avoiding the problem. Let's fix it. Let's fix the symphony. Let's work on the conductor, getting everybody in sync. So on this slide, you're going to see the brachial plexus. I love this slide because a lot of people talk about waking up with numbness in their hands or just shooting pain down their arm, and they're not sure why. And they're like, fix my shoulder or fix my arm where the pain is. But actually, the nerves coming out of the neck, going through the scalene muscles right on the side of the shoulder, or even down into the armpit and down the arm, those nerves are absolutely crucial for you to have strength, for you to have sensation in your arm, and you can see how complex that could be, and they've only got so much space. So if I collapse my shoulders, if I'm rounded forward and I and I get really, really tight here, there's no space for those nerves to bleed or breathe or get enough blood.
Just another diagram talking about the brachial plexus, and that brachial plexus is just a fancy way to talk about all the nerves that are coming out of the neck and going down into the arm.
Yeah, and they've got branches, nerves coming off at different points, and let's just not damage basically our powerhouse of our arm.
So how are you doing at moving? How are things going for you when you're trying to lift at work or lift at home? You know, are you working on weekend warrior projects like I am at home? Are you having problems getting dressed, putting on a shirt? Are you having problems combing your hair or showering, washing your hair in the morning? Any activities or sports? And even an activity like cycling requires a lot of strength and stability in the shoulder. So you may be out riding a bike and cycling a lot, but you're still having shoulder pain. And so, you know, what's going on there?
Especially in that position, right?
Mm-hmm.
Some of those, one of my buddies does a lot of that biking, and he's like hunched forward, or he's trying to get nice and small, and that just cramps everything in.
Yep. So, you know, we kind of touched on this a little bit earlier. Is there an imbalance between weakness and strength, or excessive tension somewhere? Do you already have an injury? Maybe there's an injury with some of the tendons or ligaments that's already there, or possibly a new injury. But if it's an old chronic injury, that can then be altering the tension or the weakness other places in the shoulder. And then finally, choosing your activity. Are you progressing too quickly? Are you lifting lots of weights, and are you trying to bench press too much, or do an overhead press too much, too heavy, too fast? And so sometimes it's a matter of slowing down that activity and maybe doing less weight, higher reps for a certain period of time until all of the shoulder muscles can work together well.
And I want to throw my buddy under the bus here, because I'm hoping he'll watch this at some point. So one of my best friends, this is his problem. I mean, the guy's like shoulder pressing 80 pounds in each arm. Who needs to do that? Like, he's like, man, I just don't know why I'm getting hurt. And he's a freaking wall. Like, it's almost frustrating. You know, you're playing sports or whatever, and you're trying to box him out during basketball, and you can't because he's just so strong. But you don't need to be lifting that. Is it worth it? What's your priority? So if you're like, man, I just get really sore because I'm playing tennis for 8 hours every Saturday, maybe don't play for 8 hours. Like,
maybe 7.5. I tell Brad he needs to stop lifting 75 pounds overhead, but he's not listening.
75 is 80. That's
80,
your break.
That's the magic number.
So just pick your activities well, because it's not, sometimes you have to pick priorities. And if your priority is like, man, I got to hit 100 with my shoulder press, well, go for it, and then come here and we'll fix you after.
After you have surgery.
Yeah, you probably will need it at that point. So that kind of leads us right into this, right? So are you at risk for an injury? Do you have that scapular issue already? Are you weak or too tight, or are you picking the wrong activities? And so one of my favorite things is that if you're playing tennis, if you're playing racquetball, if you are bowling, how many of us stop and say, you know what, I'm gonna grab like a TheraBand, and I'm gonna just do some warm-up shoulder stabilizing exercises to turn everybody on, right? Get this muscle on, and really get ready for the activity I'm gonna do. Or do we just say, hey, let's go play racquetball as if we're 20 and things didn't matter, right? Back then we had a more pliable tissues, or we didn't have some of the impairments that we are dealing with now. So we could handle just go and do. But now you've got to prep. And if you prep, you won't have to hang out with John and I
as much. So, you know, how are you moving? How are things going for you? Do you have pain when you're getting dressed? Do you have pain when you're trying to comb your hair or do any grooming type activities? Are the shoulder blades stable? Are you having that stability at that scapulothoracic joint? Are muscles tight on the front of your body and the front of your chest that may need to be stretched out a little bit? A couple of activities that you can do to help minimize any problems that you're having there are some stretches at the shoulder, doing some wall slides and different activities like that.
Yeah, so the other time that we have a lot of pain is when you're lifting at work, lifting at home, lifting your kids is one I hear all the time. moms who are like breastfeeding a lot, or they're carrying babies all the time, and they always carry the baby in the left arm. So they've got all of that strain on just one side, and the other side doesn't get it as much. And then they have an injury, or maybe it's just constant pain, right? And then the other one is like pushing a lawnmower or holding a weed whacker, right? And you're out there weed whacking for a half hour, and you're just holding up that weight when you really weren't ready for that type of activity. So yeah, get into those functional movements, find out what the real problems are.
You're hammering a lot at work, or hammering a lot at home.
Or your home activity, right?
Yep.
John's got some really cool stuff he's doing in the garage, some woodwork stuff, and those activities. You've got to prep for it.
It's coming together. I'm gonna be putting a video out with that. I'm taking some still shots as I go, but I want to get a little further along to kind of show what I've been working on at home.
Yeah, so check that out so John can show off what he's doing, because it really is way cool. So hop on the Facebook page and you guys can see that in a couple weeks, right?
Yeah, hopefully.
Awesome. So we want to get into some of the exercises you guys can do right now if you're not injured. Remember, all of this comes with that caveat that you don't have an injury or you don't need an assessment. These are just some ideas. So if you aren't sure, go see a physical therapist. The ones at Rocky Mountain are the best in the Valley, obviously. And we'd love to teach you and make sure that you're ready for this. Make sure it's something safe for you to do. But you can see shoulder mobility. This is something you're like, man, I'm just stiff when I move. Okay, so let's stretch it out. Get the pulleys. A lot of my patients, even though they're fit and they're fine, we still warm up on the pulley. It's a great way right before you do an activity. Get the arms moving. If you are just right after surgery, a pendulum's a great way. Sliding your arm on the table or wall slides, just get that arm moving so that the tissues can let go.
We have some activities here. This bottom left picture, he's using a stick to get a little bit of stretching going on and get some extra movement. And then we have the band. You know, bands, you can pick up bands at different sporting goods stores, or you know, I think even some of the bigger box stores, you can get these bands for exercise and activity. These are just some ideas of exercises you can do to start to strengthen and work on stabilizing that shoulder and really work on all of those muscles that we've been talking about. These are just kind of some beginning exercises, some entry level, but exercises that can get you going, and that we definitely would love to talk more with you about when you come in.
Awesome. And one more thing that I want to give to you guys is our favorite exercises for that stability. Now, that was the entry level stuff, right? The easier stuff. But we're going to give you our two favorites. So my favorite and then John's favorite. Both of us are putting our two favorite stabilizing exercises so that you guys can learn the higher level. Maybe you're not injured. Maybe you want to just maintain or build stability to prevent an injury from happening. And that's our favorite thing. So we're going to give those away to you guys just in a little bit.
So not only do we want to consider the shoulder, but we want to consider what's going on above the shoulder and below the shoulder. Again, we've kind of touched on this already, but the neck is easily involved and can be compromised if there are problems with the shoulder. And then if you go below the shoulder, the joint below the shoulder is the elbow, and even down into the wrist. So tight elbow muscles can lead to tennis elbow or golfer's elbow, like we talked about, can lead to wrist problems, possibly carpal tunnel. So really, the pain that you may be experiencing right now might only be at your shoulder, but what may be coming down the road? What are other problems that you may be facing if you don't address your shoulder issues right now?
Yeah, and the other way around too. Maybe you have a wrist issue or an elbow issue that's causing the shoulder problem. So it's all connected, and that's one of the best things about working with a physical therapist is we do all that thinking for you, and you just have to worry about doing what we show you to do. But every time you work with a physical therapist at Rocky Mountain, we're assessing your neck, we're assessing your elbow, we're worried about all those things, even if you're only focused on the shoulder. So.
And something to think about. You know, we would certainly love to have you come here to Rocky Mountain. We think that we're pretty good at what we do, but maybe you already have your go-to therapist. Are they considering and looking at these other things? Definitely a question to ask them if and when you go see them. Hey, are you looking at my neck? Are you thinking about my neck or my elbow when you're looking at my shoulder? Or you know, if they're looking at your knee, are they looking at the other joints that are around that? So something to consider when you are working with a physical therapist. Are they taking everything into consideration?
And that's something that this is a team approach. So there's nothing wrong with you having those questions coming with them. I've had patients come and say, hey, I want to interview you. I don't know if I want you as my coach. And that's totally an appropriate thing to do. And the good news is that a lot of physical therapists out there are taking these things into consideration, but you've got to advocate for yourself. You've got to ask the question, because some of them might just be, here's the shoulder stuff, go do it. So we want to make sure we're getting the right care, specific care, fixing the problem, the cause, not just the pain and the injury. This is one of my favorite things. I'm going to talk about this.
Okay.
So I love crossbody syndrome. I'm a huge advocate for this. Your body adapts to the position that it's in. Your muscles get shorter when you put them in a short position for a long period of time. Your muscles get longer when they're in that position for a long period of time. Our body adapts like naturally all the time. And so what posture do you want it in? What type of length do you want in your muscle? Because you're telling it what you want. And this is the most common one right here, where you're slouched forward if you're on your phone or working on a laptop or showing off your muscles like John, right?
Yeah.
So that position, when you're rolled forward, when your head's forward, you're going to get really tight in the back of the neck. You're going to get really tight in your pecs. If you just touch up here, most people are like, oh, I didn't even know I was that tender, right? And it's not because you've been to the gym or something. It's usually because you just left it in that short position and the muscle's angry. And then you're going to get really weak in the front of the neck. You're going to get really weak in your back. And all of that's just because it adapted to where you told it to be. So let's fix the problem by simply just putting ourselves in a much healthier posture.
You know, our society, we're not set up to go any different from this. So we have to really be conscious to fight against this poor posture, right? We're all sitting in our car, driving our car. We sit in our comfy recliner and we're watching a movie. You're texting on your phone, and your posture is just absolutely horrible. And so we really have to be conscious to fight against that forward rounded posture and make sure that we're taking care of that. I don't know if we can turn you into an army soldier like this guy on the left, but if we can make just minor changes, those minor changes can sometimes make a huge difference.
Yeah, I mean, if your head weighs 12 pounds or 14 pounds and you slide it forward, now it weighs 60, well, just bringing it back even halfway, now it weighs 20 or 24 pounds, that's way lighter. Mm-hmm. So minor changes is always going to make a big difference, and ultimately just improving gradually over time, because it took time to get into that bad posture. So
a couple of neck exercises to consider.
These are gems. I love these.
Go for it.
Oh, you're going to let me do this?
Yeah.
I took the last one.
I could hear you. You're like, oh, I want to do that.
I'm just so excited. You guys, these are awesome. I love these neck stretches. And John and I have read a lot of the research, and the research says 30-second stretches. So as you get into these stretches, you want to hold it for 30 seconds. If you're like, okay, I did what they said. Why am I not better? You got to hold this. It takes time. It takes effort. But these stretches, going to the side, going diagonal, you're hitting those upper trap muscles. You're hitting that levator scap, the scalene muscle, all of these muscles in that upper shoulder. If you're like, man, I am just stressed. I carry my stress in my shoulder. I'm not a big believer in that. I think that you're carrying your tension. You're carrying your bad posture in your shoulders. And so these stretches are perfect for that. I love these stretches.
30-second holds for your stretches for sure.
Work into it slow. We don't want to just dive in and be like, okay, 30 seconds. You got to get in where you can feel some tension, and maybe you pull a little bit more during the 30 seconds. John is really good with these stretches with a lot of our neck patients, where he doesn't even let them use their hand at first, right?
Right.
Like you just move your head.
Like the guy on the left here.
Yeah. And you're going to already feel the pull. You'll feel it right through the shoulder. Now you can go a little bit farther as the muscle lets go. Work your way into the stretch. Be safe. Be smart.
And don't do too many. I mean, you don't need to go do 50 of these. You know, if you do 2 or 3 of the stretches and you really give it a good hold, that's typically sufficient to get those muscles loose and have therapeutic release of those muscles.
Yeah. Oh, go back real quick. I don't know if we can. I'll just tell you guys about it. One of the exercises I skipped on accident was when you're laying on your back, tucking your chin in and then lifting the head up. That's going to get that front of the neck stronger. Like we talked about how you get weak in the front of the neck, weak in your back. So tuck the chin in when you're laying down, lift your head up just a ½ inch and get those muscles in the front to engage, and then set back down with control. We don't want anything like this. You want to keep the chin tucked in, and that's going to get you a lot stronger.
So these are a couple of exercises for the wrist and the elbow. Again, stretching the wrist down, stretching the wrist back. We've got some images here of people doing wrist curls, both forward and backward. And the guy has a pretty light weight here in his hand, but really, if you're really isolating and you're focusing on that wrist, you don't need to have a 50-pound dumbbell in your hand when you're trying to do. Well, you're the exception. You're the exception to the rule, Brad.
It just got those huge forearms.
So yeah, you don't need tons of weight when you're doing these wrist curls, going forward or back. So exercises that are good, again, for joints above and below the shoulder.
Yep. So let's get into the 8 tips. These are some things that you can start doing right now. Sometimes you need rest. Sometimes you just do. Activity avoidance is what we talked about. Sounded like, oh, don't do that ever, right? Activity avoidance is part of that pain management. Like we talked about, avoiding playing tennis for 8 hours and playing only for 3. That's an activity avoidance that's appropriate. Or maybe I am resting. I'm not going to play tennis right after I ripped my rotator cuff. I got to rehab it first. So rest, give it some time. Those first 3 to 5 days are the most important, just to right after an injury, moderate to major, right?
And sometimes rest, after you have a strain or stress or something's hurting, and maybe you do need to rest for a week or a couple of weeks and let it calm down. Certainly that's appropriate. And then you resume your activity. If you resume your activity after resting for a couple of weeks and the pain comes back or it's not really better, that should hopefully be a flag for you that, hey, something is really wrong and I need to address this and take care of it. We're not advocating a 5-month or a 10-month rest for everything. Again, if you have surgery, then it might be appropriate that you take a long rest. But if it's your common ache, strain, pull, a few days rest might be appropriate, but don't just permanently rest and stop the activity.
Your muscles are atrophying. When you stop using them, they go away. You don't use it, you lose it.
The next thing is ice. Ice is good, especially after an acute injury. The first day or two after you hurt something or you injure something, ice. I love ice.
Yeah, really good for that. And then we want to do some compression, KT tape, even Leukotape for support and compression. Sometimes a sling is something that we do a lot of with more major injuries, or sometimes a brace even can give that compression.
And then elevation. So kind of hard to elevate the shoulder.
Don't do it when you haven't showered.
But these 8 tips for pain management are not just for the shoulder. They're for every part of your body. So, you injure your wrist, you injure your elbow or your ankle. Elevation is a really important part of managing your pain after an injury. A lot of people may have heard of RICE. And so if you look at the first 4 letters of these first 4 items, RICE, RICE. There's your rest, ice, compression, elevation.
And the next one is to stop checking and rechecking. That's our job. No, you're going to say like, it hurts when I do this, or it pops when I do this. And all the time, even my own family will come up and be like, man, when I do this, and I do that and it keeps popping, and they'll do it like 12 times right in front of me. Stop doing it. Like,
stop already.
Just give your body a break. Like, it hurts when I do that. Don't do that right now. Now, I'm not saying don't ever do it. Let's find out what's causing that problem. But don't check, recheck, and like, how high can I lift my arm? Okay, it's a little bit better. Okay, it's been 30 seconds. How high can I lift my arm? Give yourself a break. Give yourself time.
Number 6, medication. Medication is great. It's great that we live in this day and age and we have the medications that we do have available. Certainly they're helpful and they have their role. But physical therapy is really a key part in trying to avoid opioid use or minimize opioid use. And so that's something that we can really do for you here. We have different instruments, different devices, different techniques that we can use to help minimize your pain without having to use and rely on opioids.
Yeah, you got to be careful with the opioids, especially Utah is what, number 3 in the United States? We're pretty high up there for the most opioid use. It's really easy for doctors. I don't blame them. You know, somebody's in your office. They don't have the modalities. They don't have the skill set that we do to bring down that pain. And they've got 10 minutes with you and you're in pain. Well, they don't want to just leave you out to dry. So they're giving you what they can. But we want to minimize that need, that reliance. You don't want to get addicted to it. Take your pain medicine. We've got to be able to move. If I'm in so much pain I can't move, well, bring that pain back down with pain medicine. That allows you to rehab and heal much, much faster. But if you're like, I'm a 1 or a 2, you probably don't need the pain medicine. And we don't want to be killing our liver, getting stomach ulcers, and there are negative side effects. If you don't know what those are, throw it in the comments or just let us know. We'd love to chat with you. If you're like, I want to understand more, why is ibuprofen something I've got to be careful with, or opioids? We'd love to chat with you guys.
Number 7, strengthen. You know, as you strengthen the muscles that need strengthened, and I want to throw stretching in here too. That kind of fits in that category. Strengthen appropriate muscles and stretch appropriate muscles. So it's a fine line of knowing what needs to be stretched and what needs to be strengthened to then improve mechanics.
Yep. And then last, see a physical therapist at Rocky Mountain. We'd love to help you guys if you need that guidance, that hands-on treatment. If you want somebody who's guiding you, you've tried on your own already, then that's the next step. You got to go and get some skilled help. We actually have 6 clinics here in Utah, one out in Grantsville, and then the other 5 are here in Salt Lake Valley. So you've got a lot of options. Obviously, they want to work with John.
We're the best.
There's only one John, so
that's true.
Not everybody gets to work with him.
That's true.
So, but yeah, that's the next step. Go ahead. All right, so the next step is keep moving. We talked about resting, we talked about icing. It's been 3 or 4 days. You got to get moving. We got to move safe and do this gradually. We might work back into activities carefully. We might have to start kind of like we're a child, right? We're starting here and we're going to work our way into some of those movements again. And then improve your mechanics. We want to move better. And so if you have that scapula, that shoulder blade that's moving all wonky, and all you do is put some tape on, or all you do is ice it, or all you do is some isolated exercise, but you never fix the stability part, it's not going to go away and stay away. And remember that not all pain is due to injury, right? There are good pains. Pain is just information. It's helping you understand what's going on in your body. It's how your brain processes the information it gets from the nerves. And so we need to know what is the right kind of pain, what's a good pain. I've had patients, one total knee replacement. That's the most common, where they're like, okay, what's wrong? It feels unstable, it's swollen, whatever. And I can help bring them a lot of comfort, say, you know, you're okay. This is absolutely okay. You should be feeling this type of pain. Or versus, okay, maybe we need to find out if you have a blood clot, or maybe there's an infection or something. So that's something where a physical therapist at Rocky Mountain can help you not only know what's the right pain, but also fix those injuries, or better yet, prevent the injuries.
Yep. You know, talking about pain, and not all pain is necessarily bad pain. I've worked with people, and Brad touched on a knee replacement. I know we're not talking about knees necessarily today, but I think that this is a good analogy and hopefully some good information for you. You know, I've worked with people, and they said, yeah, my knee hurts after the surgery, but I know it's a good hurt. I know that it's going to be getting better. And so, you know, that bad pain and good pain are kind of two different things, two different situations. And hopefully we can help guide you through that and help you navigate that. You know, here at Rocky Mountain, most of the clinics, we're open to see you, give you a free screen for 10 to 15 minute screen, kind of look at what's going on, talk you through what we're seeing. You know, it's not going to be an all-inclusive evaluation or treatment or anything like that, but please feel comfortable to reach out to us. We're going to give you our contact information a little bit later, and you know, we're happy to get you in and take a look at what's going on and see if it's appropriate. Maybe PT is not appropriate. Maybe you really do need to go see a surgeon, but that's something that we have to offer, and we want to be a provider for you in the community for that.
And as we built our, John and I have been here a while, and we built some of that following where people trust us. And so last 2 weeks, I've had 3 patients who came in, we did an evaluation, and we sent them off for an MRI and a consult with the surgeon. So even if sometimes that we can be that first person to help you understand what direction am I supposed to go.
Yep.
So, and that's John's jumping ahead and giving you guys what our free things are. These are the 2 gifts that we wanted to give you guys. We already gave you or we didn't get to the gift yet. We have another gift coming of our favorite exercises, right? But these first 2 gifts, there's an ebook completely free. It has a lot of the information that's here in this slideshow about different injuries and about pain management. So that's completely free. If you are signed up for this webinar, then you're going to get that ebook automatically. If you
haven't got it already.
Yeah, if you haven't got it already. If you are not signed up and you're watching this some other way, then let us know and we can shoot that out to you. You watch the webinar, we want to give you all that information. That's something that they can share with anybody, right?
Mm-hmm.
You can share that with your family. You've got a sibling, a neighbor, somebody who's dealing with shoulder pain. Share that ebook. It's something that we are completely comfortable with you sharing. And then the next thing John talked about already, the free no obligation consultation. We just want to be here to answer your questions. If you guys want to come in, all of our clinics, or the majority of our clinics are actually in on board on helping with this. John and I do the most of these free consultations, right? But if you go to any clinic, make sure that you mention the webinar so that they'll do the free consultation with you.
So here's the 2 favorite special exercises. So mine is here on the left, and if you look at the top left picture, he's holding a band, which maybe you have the band, or maybe you want to try and go pick up a band at the store. And so he's holding his hands about shoulder height and holding them about shoulder width, and then he's going to pull the band apart. So this image doesn't show it very well, but he's going to pull, oh, there it is.
Bottom left.
Bottom left. He pulls them apart. Now, as he pulls them apart, you don't want to just have it occurring at that ball and socket part, but you want to get the shoulder blades involved. And you want to get the shoulder blades involved without using the neck muscles. So that's a really important part. You don't want to be hunching your shoulders like Brad just showed you over there. So you can see he's holding his hands, if you looked at a clock, 3 and 9 o'clock, and he's pinching the shoulder blades together, bringing the shoulders apart. Then there is 2 and 8, and then there's 4 and 10. And so you're going to be strengthening those shoulder blades, stabilizing those shoulder blades in different planes of movement. One of my favorite exercises, I teach a lot of my patients that to really help get those shoulder blades not only stabilized, but get them moving and doing some activity, because we do activity as we function in life. It's in a lot of different planes. It's not just in one plane of movement.
Especially with the shoulder. The shoulder is an extremely complex joint, as you saw throughout this whole presentation. Now, mine's the one on the right here, and I love this one because you've got the wall, and if you focus properly, you're going to pull, I don't know if you can see this, you're going to pull out with your hands as you slide up and down. So John's works a lot of the stabilizing muscles in the upper back and mid back, whereas mine's working the under muscles, the kind of the underbelly ones. These ones keep your shoulder blades hugged right up against flat. There you go, right up against the rib cage. And these ones are awesome. And there's variations too where you can move your arms in and out. But just keep that simple for now. You've got that band, pulling it out to the side as you slide your arms up and down the wall. Make sure that you're letting your shoulder blades move, not just leaning forward with your body. If this is something that's confusing, if we're not explaining it well, part of that free consultation, I'll throw this in. Come by, I'll walk you right through how to do this. If you're not injured and you're like, I'm trying to prevent injury here, come by for a consultation. I'll show you how to do this one.
And these exercises may seem pretty simple when you look at them, but I'd say inevitably, all of my patients, I'll give them the lightest band that we have to work with, and they start doing these exercises. And if they're doing them properly, they get done with 8 or 10 repetitions, and they are not very happy. Yeah, I shouldn't say not very happy. They just feel the muscles working. Yeah. So if you're doing these exercises properly, they really will exercise and fatigue those muscles that we're trying to target.
Yeah, and it's something that looks simple to do, but has a little bit more complex to make sure you're doing it right. It's super easy to do it wrong to compensate, and so make sure you're doing it right if you're doing it, or have us watch it for you. So back to the slide, all about these injuries. Any other questions? I know that Megan mentioned tension headaches. So tension headaches coming from a lot, this is actually my specialty, is headaches, migraine management. I do 30% of my patients, 40% of my patients are all about this. And you've got these trigger points in your upper traps, you've got trigger points in your levator scap. All of these muscles that we talked about up here cause pain to radiate up and over the ear to the sides of your head. You can get other tension in the neck muscles, which also can cause tension headaches or migraines. And that's coming from compensating for the shoulder. And so one of the most common things is I have a shoulder injury and I'm getting this stinging pain in the side of my head. The shoulder is not causing that, but a side effect of that is the upper trap is super tight and they get referred pain up there. So hopefully that answered your questions, Megan. If you have more questions on that, let me know. Did you guys, anybody else on here have questions on any specific joints? I don't see any other comments. You guys all good? If you have your injury and you're like, well, I do have questions, but I want to get to talk to you. Oh, so I don't know how to go. Maybe hit stop and then go back. Oh, that's the wrong one. No, I don't know. So maybe there we go. Perfect. So if you have questions specifically for you, oh, thanks, Megan. I'm glad that worked for you. And you're like, I don't really want to ask it here, but you want to talk with us about it. That's why we have that free consultation. Come on in. We'll answer your questions, explain what the anatomy is causing that. Yeah, hopefully that helps.
So this is our address, our phone number, email. Please feel confident reaching out to us. We, again, want to be a resource for you and help you navigate any questions or concerns you have about your shoulder.
Yep. That's all the information. Thank you guys so much for joining in. We're going to do one of these every single week or every single month. Mm-hmm. Every week. Cool. That'd be a lot of work. Every single month, we're going to pick different topics. So make sure to come back for those and then check out our Facebook page where we're going to be posting weekly videos and we're educating as much as we can to help you guys. So let us know what you guys think. Shoot us an email with any ideas or topics you want us to cover.
Thanks, guys. Have a good evening.
See ya.